What about some critics contend that this bond initiative is really a backdoor way of compensating children's hospitals for Medi-Cal and unpaid costs that you've had to, unreimbursed indigent care?
Well, first of all, if you look at children's hospitals throughout the state of California, all of them see a high number of Medi-Cal patients, and all of them have a significant gap between what it costs to provide the care and what is reimbursed by the state of California. To use Packard Hospital as an example, in 2007, the difference between what it cost us to provide care to the children that we served, who were sponsored by the state of California through the Medi-Cal program, and what we were actually paid was over $130 million. That was in 1 year in one hospital. So as you can see, it is absolutely critical that we find other avenues to ensure that we can invest in facilities and equipment for the future. If we're losing $130 million in 1 year on that particular population that we're serving, we obviously will not have enough money to invest in new facilities and new equipment and so forth, which in our facility we're expanding to ensure that we don't turn children away. And in other hospitals, children's hospitals throughout the state, if they're not expanding, they're replacing aging facilities or facilities that have to be replaced due to the seismic requirements of the state of California. So in our minds, it is absolutely critical that we move forward with this. And since we were not able to get it through the legislature, as Sherri indicated, that this initiative process was a process that we pursued.
You've announced a significant renewal rebuilding process at Children's Hospital. A significant process that's going to be making its way through the Palo Alto City Council. What impact and how is Proposition 3 correlated with this program?
It's a critical part of this program, Paul. We're looking at adding over 500,000 square feet to our facility. That will include building about 165 additional beds. It will include new operating rooms, new imaging center, and so forth to ensure that we meet the needs of our local community as well as the broader communities that we serve. The price tag on that is going to exceed $1 billion. It is absolutely critical in our ability to complete that project or even start that project that we secure the $98 million that would come through this initiative. If we don't, then we're going to have to find other sources for that money. And quite frankly, I think we're going to tap all the sources that we can just to get to that number, and therefore we probably have to scale down the project in some way or another. And so we find this absolutely critical here at Packard. And I think that is also very true at the other hospitals throughout the state that are counting on this initiative to either complete their projects or to initiate their projects.
So, what's the impact to Palo Alto residents, citizens of the peninsula, if Proposition 3 fails? What's the impact?
The impact is that we will continue to look at capacity at children's hospitals. There will be some children's hospitals that may not be able to either rebuild in terms of seismic or add the additional capacity that they need. The children's hospitals really are the pediatric safety net for the entire state. And what it just means is that there will be children who will go unserved. There will not be a place where children can get the kind of care that they need and deserve.
Are there three key points that you'd like to, when you see people in elevators, when you see citizens on the street, when you talk to your neighbors and friends, what are the three things you'd like them to remember when they go and vote about Proposition 3?
I'd like them to remember that in the face of the state budget, this is really a very small piece, but it's an absolutely essential piece.
A critical piece.
A very critical piece for children and for the children's hospitals that serve them. And that the good news is that we're saving more children than we ever have before. And we need these kind of resources and the facilities to ensure that we'll be able to continue to make these strides to find additional treatments, give a quality of life to children with complex health care needs. This is the future, and caring for the most vulnerable population in our state is the role of government, is the role of the community. This is what Proposition 3 is all about, taking care of the most vulnerable in our state.
So when people complain about the use of tax dollars, this is the wisest use of tax dollars. These are going to really meet significant needs of the citizens of the state.
Absolutely. When you look at the children that we take care of, I mean, the good news is the vast majority of children do not get sick, and that's the good news. Unfortunately, some children do get sick, and we've been very fortunate over the last 1 or 2 decades to where we're able to save more and more children at birth, more and more children from cancer and heart ailments and so forth. So that's the good news. The challenge is that we need to ensure that those children have access and future children have access to the expertise that each of these children's hospitals have. And if we don't, if we're not successful with Proposition 3, there is no question that access will diminish throughout the state of California. In our local area, we'll simply have to scale back the project in one way or another. And the idea of doing that is daunting in my view. On a more broad scale, we could see other children's hospitals who I think will have significant difficulty even rebuilding their current facilities to meet the seismic requirements. So I think the impact statewide would be quite significant. Versus an investment, as Sherri said earlier, of less than 1/10 of 1% of the state's annual budget. We're looking at a very, very small investment for the state of California in a major initiative that will impact children and therefore our future.
Chris Dawes, Sherri Sager, thanks so much for joining me at 1 to 1.
You're welcome.
Thank you.
The preceding program is copyrighted by the Board of Trustees of Stanford University. 1 to 1 is produced by the School of Medicine's Office of Communication and Public Affairs. For more information, please visit us at mednews.stanford.edu.